Hi everyone, it's Angela with Strong Meridian and welcome to Functional Friday, where every Friday we delve into functional and holistic wellness tools, from functional foods to supplements and herbs, and functional medicine testing. Learn the benefits and the hidden traps of natural wellness. So it's Friday, grab a cup of coffee, grab a cup of tea, maybe your glass of wine, and let's begin with this week's topic, dysbiosis. What is it? And how do you know you have it? Let's get started. Okay, what's dysbiosis? It's a funny word for too much bad bacteria and not enough good bacteria in your gut. To be honest, your whole body is covered with bacteria, and you can have a biome in your gut. You can have a biome in your lungs. You can have a biome in your nasal cavity. And all those different microbes, from the beneficial ones to the not so beneficial ones, they can all be different depending on where they're settling in the body. Now, when I think dysbiosis, I'm definitely thinking the gut. And you might think, okay, if I have dysbiosis, I got something funny going on in my gut. I'll have gas, I'll have bloating. You might have diarrhea and constipation. Like those are give me's and those are easy. And yes, that can be dysbiosis. But let's get out of the gut. Let's look at the whole body and see how the dysbiosis within the gut actually does affect the whole body. You can have symptoms of eczema, psoriasis, how about acne, even frequent urinary tract infections and frequent or recurring sinus infections can be signs of dysbiosis. And what about bleeding gums? Tooth decay. When you brush your teeth, do you get blood either at the gums or on the toothbrush? Yeah, that can be an imbalance of good to bad bacteria. And one people may not think of. What about symptoms of anxiety and depression? All these mood disorders, this alteration. Do you know that your gut talks to your brain more than your brain talks to your gut? And when your gut is inflamed, so is your brain. When your gut is out of balance, your brain can be out of balance too, because you actually make more neurotransmitters in your gut than you do in your brain. What are some symptoms of like a dysbiosis in the gut that could be affecting the brain? So we talk mood, but what about like brain fog, trouble concentrating, and fatigue? Those can all be related to the gut. So pretty crazy. And I really want you to think of the gut as, yeah, it is. It's the root cause of a lot of problems, if not almost all of them. All disease begins in the gut. So this is where we gotta get in there, see what's in there. Do you have too much bad bacteria? Do you have a candida overgrowth? You really don't need to check out saliva on a glass. You need to do some stool testing. You need to find out which type of bacteria, which type of fungus. Are there some parasites in there? Maybe you actually will test positive on a stool test for parasites. It is possible, even though parasites can live all over our body and not necessarily just our intestines. But it's a great place to start. So what causes dysbiosis? Well, I can speak for Americans because I am one, but if you're watching anywhere around the globe, stress. Stress definitely contributes to dysbiosis. I like to tell people, like, when you're stressed, you literally poop out your good bacteria. Boop, gone. Now, antibiotics, pretty much everybody knows, antibiotics can be pretty seriously damaging to the gut. They can wipe out a lot of good bacteria as well as the bad. Sometimes, yes, we need antibiotics, but we really underappreciate how much damage they actually do to our bodies. And we need help to recover. The standard American diet, yeah, that'll give you dysbiosis. A lot of refined foods, not a lot of color. When's the last time you ate your reds, yellows, blues, purples, and oranges, maybe even some greens, all in one day? Now, did you do that 2 days in a row? How about 3 days in a row? You got to eat your colors. All the colors feed the good bacteria in our gut. So we like that. Certain medications will also cause dysbiosis other than just antibiotics. Birth control can cause dysbiosis. Proton pump inhibitors can change the flora of the gut as well. So there are different things to consider. So if you're the typical person, stressed, on a medication, maybe you've had a round or two of antibiotics in the past year. Sounds like a dysbiosis issue. And you can have a round of antibiotics and feel fine. Maybe, hopefully you feel better because you needed the antibiotics. And then 3 months, 6 months, maybe even a year later, things start to get a little weird. Maybe the stools change. Maybe you start to get a little bit of sleeplessness or the brain fog. Maybe you don't start tolerating some foods and we have some gas and some bloating. Or that skin got a little itchy. Those things can happen, and it takes the body time to recover from the antibiotics. And if your body's not able to recover fast enough, then it starts telling you, hey, I got a problem. And that could be it, dysbiosis. And it's starting to, come out through the skin, and the bowels are different. So do you have dysbiosis? What do you want to do about it? You want to find out the level of dysbiosis that you have. What specific, opportunistic, or bad bacteria do you have? Do you have strep? Do you have enterobacter? Do you have morganella? What's in there, and how do we treat it? Once you know what's in there, we can give you specific herbs to help balance those microbes back out. And then, of course, feed the good guys. What population of good guys do you have in there? Do you need specific probiotics to help bring up a specific strain? All of this we can do for you at Strong Meridian. Get a good stool test. Find out your level of dysbiosis. And until we meet again, live vibrantly.